Welcome to Dental XP Treatment Planning Session. Parameters for integration of aesthetics and function in implant dentistry. As described over 40 years ago by Morton Amsterdam, there may be different ways of treating a disease, but there can be only one correct diagnosis. Such statement may never go out of style. The purpose of this session is to create a treatment plan where either the dentist or prosthodontist must create a team with all specialists involved from the very beginning. We need to create a treatment plan with initial diagnosis and establish a treatment plan approach, interdisciplinary communication from the onset. There must be a leader of the team understanding what the short-term goals and long-term objectives are. We must coordinate and maximize the results and minimize any compromise for the long-term stability of such treatment. Always understanding what is the best for the patient as it relates to long-term health, function, and aesthetics. Glorianne is a 66-year-old female who needs interdisciplinary treatment. There is no agreement on the treatment plan as she has seen 2 periodontists and 2 prosthodontists. She is somewhat concerned about the cost, but ultimately wants the best treatment option. Such treatment started in 2010. Patients' concerns are aesthetics. She knows she has an open bite and there are periodontal problems. She would like to achieve long-term periodontal health. She is concerned with the stability of the upper arch as she perceives that's where her main problems exist. And she does know she has a problem with her occlusion due to the anterior open bite. With the conflicting opinions she has received, she does not know what is the best treatment plan for her. What are her options? When we see the patient smile, we can see the lower incisor is calcified and has no vitality, and she doesn't like the aesthetics on her smile, let alone the function. When we take a close look, her bite on the right side and the left side is not very stable because she knows she has periodontal problems. This is the type of occlusion she's had practically all her life, and she would like to know, how can this be corrected? Who needs to be the team leader to be able to help achieve her aesthetic goals and her functional desires? When we take a look at her occlusion, the upper restorations and the lower restorations on the posterior teeth, they lack great detail as it relates to a proper occlusal anatomy. She's not happy with that, but that does not seem to be the major issue or the main concern that she has. She has a few silver fillings that are breaking down, and she's hoping that at the end of treatment, all issues will be resolved. From a lingual view, we can see that there is some recession and the tissue is quite irritated, and she would like to know how to solve such problems. When we evaluate the radiographs, we can see for the most part there is stability on the lower arch, and the upper teeth, mostly posterior, upper right, have class 3 mobility, and on the upper left first premolar has very little bone supporting the tooth. On a closer look through the periodontal charting, we have some pockets on the upper right premolars and molar that are mostly 8 to 12 millimeters, and on the upper left side the premolar has lost the advanced bone with a very deep pocket. These 4 teeth in particular have a class 3 mobility, so we know that the prognosis for these teeth is a hopeless one. On a closer view, we can see the amount of bone loss that these teeth incurred, and she really does not have any discomfort as it relates to the temperature or any sweets. It's mostly the instability from a periodontal point of view. So the question is, what is next for her? She would like to have the best possible treatment, so we need you to please write a treatment plan that's going to solve the patient's concerns, and a breakdown on the treatment plan by sequence, techniques, and materials that are going to be utilized during the resolution of the patient's problems. When someone shares something of value with you and you benefit from it, you have the moral obligation to share it with others. We do welcome your participation in this treatment plan session and looking forward to phase 2 of this presentation. Thank you.